Hi, my name is Parag Patel, and I'm a third-year medical student at Nova Southeastern University. This presentation is on the prediction of heart failure mortality using an adaptive boosting machine learning algorithm. Cardiovascular disease, including heart failure, is the number one cause of death in the United States, and it's known that a myriad of factors can both contribute to and predict mortality in these heart failure patients. Identifying patients who are at high risk of mortality is important because it can guide medical treatment and prevent some of that mortality from occurring. However, one of the limitations of current risk assessment tools is that they can't fully take into account a large number of clinical variables and account for the interrelationships between those variables, which may be nonlinear. Therefore, the aim of this project was to develop an efficient machine learning algorithm that can predict mortality in heart failure patients while accounting for a number of different clinically measurable variables. To do this, a dataset of 299 heart failure patients with 12 different clinical variables, including age, anemia status, ejection fraction, sex, and smoking status, was identified for training the machine learning algorithms. 9 efficient machine learning algorithms were then trained on that dataset in Python, and the most accurate algorithm was then selected for predicting mortality. The results indicated that the algorithm with the highest predictive accuracy was adaptive boosting, also known as AdaBoost, which had an overall accuracy of approximately 77%. Other algorithms that scored similarly but slightly lower included the RBF SVM, or Radial Basis Function Support Vector Machine, as well as the QDA, or Quadratic Discriminant Analysis, and NN, or Neural Network algorithms, which all had roughly a 73% accuracy. The AdaBoost was then further assessed, yielding a positive predictive value of around 86% and a negative predictive value of around 74% for predicting heart failure mortality. And the total time required for running the prediction algorithm for a group of 30 patients in parallel was approximately 5 seconds on a standard laptop CPU with no additional GPU acceleration. Figure A shows a comparison of the predictive accuracies of the 9 machine learning algorithms, and Figure B is a confusion matrix that shows the correct and incorrect classifications of mortality for the AdaBoost algorithm, which was the most efficient algorithm. In conclusion, the results of this study show that machine learning algorithms can incorporate many clinical variables into making an individualized risk prediction for a given heart failure patient. Adaptive boosting, or AdaBoost in particular, seems to perform accurate and rapid predictions without requiring a GPU computer, and this increases the clinical utility and accessibility. The positive predictive value for mortality is greater than the negative predictive value for survival, and this was true for the AdaBoost algorithm as seen in this study. As with all machine learning algorithms, the key limiting factor is the size of the dataset available for training the algorithm. Therefore, as larger datasets become available, there is a lot of potential to improve this prediction model even further and improve its accuracy as well as generalizability. That concludes the presentation. Thank you for listening.